We've heard a lot about evidence-based policy making here over the course of the proceedings, and I'd like each of you to reflect on the importance of the data which your surveys is collecting and the ways in which these data have been used in policy discussions. So Letizia, maybe you would like to start.
Okay, yes, I think that first and foremost, the quality of data is very important. So, of course, with this research infrastructure, we are able to assure the collection of good data. But I think it's also very, very important, the comparison, because when you study one country, you can understand the unique situation of that country or some universal trends that we have across society nowadays, and these are coming out only from comparison. Another thing that is very important, and that more and more these data adhere to this FAIR principle, so to the idea that the data are fundable, accessible, interoperable, and reusable, with the fact that these data are there to be used for free. And I think this is a very important tool for evidence data policy analysis. Then, of course, these create also some challenges on the data, but first and foremost, I think this is important. Then the other things is, of course, to understand also how collecting data is changing. Maybe we will talk later. I forgot to say that, for instance, GGP now is using mixed methods. So we are not we are going online with Kawi and also CAPI. We are not doing a paper, pencil survey.
Okay. So with SHARE, since we are an aging survey, so the purpose of the data, which is also, of course, open access data for researchers, is to analyze and advise policies on retirement, health, and healthcare. These are the main topics for the research. So the data is not only used by researchers from universities, but also from DG institutions, DG employment, and they were used for important things which you see around, like postponement of retirement ages. So when you have the panel, you can follow the people over time. You can provide different incentives in each wave in different countries, you know, how much they would need to receive to postpone retirement, you know, why they are retiring, and all these questions to actually see and use this data for policy recommendation, and actually this was used in several countries, including you know, in the Czech Republic. Other of course data you can use is for long-term care planning and capacity of healthcare providers. Especially what we have in SHARE is you know, well-designed social network modules in which we actually ask, you know, who exactly in the family cares for the old people, with children, daughters, mothers, and so on. So we can actually map not only healthcare in terms of the institutions, but also inside the family provision in terms of time and money and help and all these things. And so these are like the most obvious examples of policy analysis. But the data, yeah, I will stop here. I will give it to you.
Thank you. This is always a bit of a dilemma for us in European Social Survey, because European Social Survey was not set up to be a policy vehicle. It was set up to serve the academic community, and that remains our main aim. Often you'll find if you really want to reach policymakers with survey data, the question wording has to be quite specific. You have to narrow it down. We saw a presentation earlier about the results of the Sure Start intervention in the UK. I mean, each country in Europe is going to have different kind of interventions like that. So how you then tailor a cross-national questionnaire to really get to those policy questions can be a real challenge, I think. That said, ESS data is used quite a lot in policy, and we do encourage it where it's possible. So we looked at the Overton database and found 3,246 policy documents where ESS had been mentioned from 335 different sources, including 392 from the European Union. So ESS data is kind of being picked up in policy. We also commissioned Technopolis to do an impact case study to see how ESS data was being used beyond academia, and they found a number of different ways in which the data was being used. So general intelligence and insight, agenda setting, influence on public debates or through the media and so forth, monitoring to track aspects of societal progress, and methodological impact as well. So just some sort of examples then of how it's being used. So like in Slovenia, ESS data, for example, was used to inform the resolution on family policy between 2018 and 2024. In Ireland, it was used to influence the Healthy Positive Aging Index. And at the United Nations, we found ESS data had been used to change the kind of conceptualization of the impact of immigration on host communities. So to focus both on the cultural and the economic impact of immigration. So we do find impact, but if it's not your primary aim, you need to work out what the balance is going to be.